Good evening, friends, and welcome to Insight. I am your host, Pat Gagliardo, and as always, a little later on in the program, I will be taking your calls and I will be answering your mail. We have a new toll-free number here on Insight for all of our callers. Write it down now. It's 1-800-300-TV26. But first, let's get to acupuncture, how it originated, who uses it, and why. My guest is a registered nurse and a graduate from Tri-State University in acupuncture. Good evening, Bonnie, and welcome to the show. It's such a pleasure to have you here.
Hi, Pat.
Bonnie, of course, when we talk about acupuncture, we know that it relates to needles, and of course, when someone thinks of needles, we think of pain. Would you help us to put this myth to rest? What is acupuncture all about?
Okay, acupuncture basically is about regulating the energy in the body. Basically, we believe as acupuncturists that you have your own internal pharmacy in your body, and it'll heal itself. So as a facilitator, I would put needles in different places along pathways or meridians where the energy flows, and your body would then regulate itself. Simplified, of course.
Okay. Who really, you know, where did it originate? I'm assuming it came from the Orient somewhere, but where?
China will say that they found it first, 3,000 years ago. And then there's some ancient finds of acupuncture needles made of bone in India. They're found out of elephant tusks. There's just all different kinds of things. So basically China, but Korea will say they were there. Japan will say they were there. I really don't know.
What kind of ailments can be treated with acupuncture?
Everything soup to nuts. You have to understand, though, that we're not Western medical doctors. We work in conjunction with the regular health care team that anybody is seeing. But it works for different things for different people. And sometimes it works for something, sometimes it doesn't. But it could be something simple like stress. It could be, we hate to put Western titles on it, but somebody that has difficulty breathing. Of course, a Western disease might be called asthma or bronchitis. So there's different things.
What about pain? What about pain treatment?
Usually that's a blocked meridian or a blocked collateral. And again, we'll feel along that pathway, and yes, it does help alleviate pain.
Okay, now what's a meridian?
A meridian is a pathway that the energy flows in your body in a natural way. And we have a doll here that outlines what the main meridians are. I don't know if you can see this, but each meridian is connected to each other somehow, some way, without getting into detail. There are internal branches and everything else. But you can see that the whole body is just loaded. And these are just the basic meridians. There are, of course, special points that are not on the doll, and but there's quite a bit. So this is a meridian. It just kind of flows. It would be like veins or arteries or like your nervous system, except that meridians can't be seen. So that if you dissected a body, you would not say, there's the meridians. They're gone.
Where do you place the needles?
Anywhere along a meridian. Anywhere. Depends on, again, what the situation is, what the energetic diagnosis is.
We have a clip to show you, audience. So we're going to show you the clip. It'll be appearing on your screen now, where we asked our executive producer, Mr. Norm Whitehurst, to be somewhat of our guinea pig, I guess you could say, and you can see it appearing on your screen now. And what are you doing there, Bonnie, to his ear? That's his right ear, I believe.
Okay, what I did was I started by doing just a simple stress treatment. He never received acupuncture before. We don't know how he would react, except that he's a high-powered executive, so, I took a pretty good guess that a stress treatment might work with him. And I just palpated different points on his ear to relax him. One is called Shen Men. Another one, since he takes a few Tums now and then, I did his stomach point. I did a kidney point for energy. I did lung points to help him breathe. And basically to clear his airway,
the blockage.
So that so that he could just take a nice deep breath and try to relax. In a minute you'll be seeing we also did some wrist points. They're called Shen Men. It was just to relax him, because when I did pulses, the impatient pulse came up, and of course he's busy. He's trying to get the show going, and he wants to be on with it. So we tried to chill him out.
The ear is turning red, we see there.
Yeah.
Now, this is a normal thing?
Yes, it is. And that's very light red compared to what it'll get in a little while. But we call that cooking. He's cooking.
How long does the treatment last? And before you answer that question for me, of course, you know, there's the disease scares out there in the world, the AIDS and all of that we have to be concerned about. But what about sterilization?
Okay, I don't sterilize. I use disposable needles. I never reuse them. I use them once, throw them away. You know, there's just too much confusion and too much concern, so I'd just rather be safe. And here we are doing his wrist points, just to relax him.
And how long does the treatment last, did you say?
When I do body points, usually about 20 minutes. But if somebody just has their ear points done, they seem to take longer, so I like them to relax for about 45. But they can stay in longer. Sometimes I even send people home with little needles in their ears. And they can stay in for 3 days.
And what about persons who would see you for treatments with ailments or diseases or things that you would be working with? What about insurance?
Some insurances pay. Most of the smaller ones do pay. Blue Shield Blue Cross does not pay in Connecticut, but many of the others will.
That's wonderful. Bonnie, we were talking a little bit earlier before the program, and you're telling me that you're working with acupuncture and regression, past life regression. Can you expound on that for myself and the viewers?
Okay, this all came up, I'd say, about 1.5 years ago when I was doing a client, and she got up from the table and said, you know, I saw my granddaughter. And of course I went, yeah, okay. And she said, no, you don't understand. My daughters are not pregnant. I have no granddaughters. I actually saw this beautiful face. And this client said it was a blissful state. And, you know, I thought about it, and we talked about it, and it seemed to be a very good experience. And then, but I just let it go. Then another client, maybe last summer, said, gee, I saw my grandmother. And my grandmother, you know, is long gone. And he said, I thought we were having a conversation, and he felt very much at peace. So I let that go. And then about a month ago... You mean your curiosity didn't get the better of you? Well, it did, but I was busy doing other things, you know? And so then what happened is somebody called and outright said, do you do regressions? I said, well, no, I don't, but, you know, I'll check it out. And I started checking it out, and I called people that I knew, people that would give me feedback, and said, okay, I want to try a regression. It could be in this life, it could be any life, depending on, you know, what their belief system is. And sure enough, everybody had some sort of experience. If it was, you know, recalling something in their childhood, like the woman that saw the picture of her granddaughter, I called her back and said, you know, we got to see something. Can you do something for regression? And her goal was, she said, I would like to know why I'm afraid of the dark. And that's all we did. So I just put the needles in. I did not talk to her. I didn't want to give any kind of coercion. Just see what happens if you can think back and regress. And yes, she did remember. She saw a few, you know, scenes and all that. But the bottom line is she did remember seeing a scene where she was at her grandfather's house. And there was a darkness, and there was a dark outhouse. And she said she felt like at that moment she knew why she was afraid of the dark. But she also got up and said, past life's not so good. I like going to the future. Wow. So, you know, I've just been getting a lot from, you know, different people. Other people, another lady named Peggy, she said for her it was just a very subtle experience. She saw different things in the past, and she believed it was her, and she believed it was past life, and to just be aware that it can just be very subtle and just breeze away if you're not in tune. What is the name of the technique? I mean, of course we know it's acupuncture, but I mean, is there something that is there a phrase? Is there some sort of terminology? Oh, you probably heard window to the sky points or window to the sky stuff mentioned. And basically, there are many acupuncture points that are called window to the sky that open up different sensory areas, that clear the head, that calm the spirit, that open the mind. So always I try to include some sort of window to the sky point. But I also do pulses, and I try to balance the person. Because if we balance the person first, then they're open. Okay, this particular window to the sky, this particular meridian that obviously has to become unblocked,
What does it do? Does it, I mean, does it travel up to like the memory part of the brain, total recall? I mean...
There's different points. It's not a meridian. There's different points on different meridians that are identified as window to the sky points.
Okay.
And
can you break that down sort of like layman's language?
Well, there's
what does that mean?
All it does is it means it clears or opens. Yeah, that would be the best way, because sometimes it's used for confusion or for difficulty talking or for tight throats, difficulty seeing, just difficulty with different sensory things. There's a lung point on your wrist, the opposite side, and it's just to help open the chest and help you breathe. So, again, it's all sensory.
Absolutely incredible.
Yeah.
Boy. If you're interested in receiving a free brochure, you can write to Bonnie Carey at 400 Round Hill Road, Salem, Connecticut, 06420. Please include a self-addressed stamped envelope. If you want to call Bonnie for an appointment, you can call her at area code 203-859-3844. Stay with us, and we'll be right back. And when we come back, we'll be able to go right to the lines. Remember, we have a new toll-free number for all callers in-state and out-of-state, and that number is 1-800-300-TV26. We'll be right back. Welcome back. And for those of you who may have just tuned in, you are watching Insight Live with your host, myself, Pat Gagliardo. And we're going to go right to the lines to speak with my guest, Bonnie Carey, on acupuncture. Go ahead, Joe from New Britain. You're on.
Hi, Bonnie. I have tinnitus ringing in my left ear. Now, this is something that Western medicine can't deal with. Is it something that an acupuncturist could handle?
It's only in your left ear?
Yeah.
Yeah. Did you say tinnitus?
Tinnitus.
Yeah, okay. So you're ringing in your ear. All right, yes. Usually that has to do with the kidney meridian, and it would be something that, of course, I just can't say clearly, you know, without doing an examination or an evaluation, but you might try massaging on the inside of your ankle. It might go away.
Really? Well, thank you.
Thank you very much, Joe. Have a pleasant evening. Go ahead, Martha from Willimantic. You're on.
Yes, I was just wondering if acupuncture would help a diabetic.
Oh, you won't believe what's been happening. I do acupuncture also on some groups, in some facilities. And without the intent of working on blood sugar levels, the people have been reporting to me that they have been getting off of their hypoglycemic agents. It's been incredible. A lot of times, you know, diabetes is also due to stress, not just to all your organic things. So it's very likely that you may be able to decrease your hypoglycemic agent. Again, you'd still have to stay under the care of your physician, but I would be glad to work in conjunction with.
That sounds interesting. I have to shoot myself twice a day, and I feel like a pincushion sometimes.
Oh, yeah. Well, if you have access to an acupuncturist, give it a try.
Look that up in my local phone book. And another thing is I'm having trouble with my eyesight, too.
Yeah,
in conjunction with the diabetes.
Yeah, that usually starts. And what about your legs? Do you have the neuropathy?
Somewhat. I have one leg that swells up mostly in the summertime when the heat.
Yeah, it might help. You might want to check it out because it certainly should give you some relief.
I'll give it a try. Thank you very much.
You're welcome.
Thank you very much, Martha. Have a pleasant evening. Go ahead, Ken from Old Saybrook. You're on the line.
Yes, hi, Bonnie. This is Ken.
Hi.
Hi. My wife has a condition, a neurological condition, and it's been told to us that it's an inflammation of the spinal cord, and the symptoms that she has is numbness down the right side of her body, and this impairs her movement. I was wondering how you might see this from the point of view of an acupuncturist, and can it help?
Okay, from the point of an acupuncturist, again, I would have to palpate along her meridian. But what I can tell you is if the muscles that are pressing on the nerves are even swollen and compressing the nerve and causing maybe the sciatica, that what acupuncture will do is loosen the muscles, relax the muscles, and hopefully give her some pain-free moments. It also may clear a meridian. Many times that's what's happened.
Many times it's a blocked meridian?
Yeah, you know, again, I have to go with meridian diagnostic techniques because I'm not a Western MD.
Yes. Okay, thank you very much.
You're welcome.
Thank you, Ken. Have a pleasant evening. Go ahead, Liz from West Hartford. You're on the line.
Yes, I'd like to know how you go about finding an acupuncturist. Do you call the medical association, or do they have to be certified? And also, can it be used for weight loss?
Yes. First of all, if you call the medical association, I'm not sure that you'll get too many people that will be familiar with who the acupuncturists are in the area. You can always call the Connecticut Acupuncture Association or a National Acupuncture Association, but the best thing to do would be to check your phone book and then ask the person for credentials. Ask them if they are nationally certified. That's a universal test. It's a measure to be able to determine that somebody has attained a particular level. So if they're nationally certified, that's a good way.
Bonnie, don't you have an office in Glastonbury?
Not anymore. Not
Okay.
anymore.
All right.
Yeah.
Thank you very much, Liz from West Hartford. Go ahead, Paul from New Britain. You're on the line.
Yes, this is Paul, and my wife has had MS diagnosed since 1982. With these type of her ailment, could acupuncture help her?
Yeah. What happens is, does it get worse in the spring?
Yes, it does.
Yeah. What happens is sometimes acupuncture can work, but it might take a long time. But it's something that might be able to give her relief and prevent that worsening that happens in the spring. So you might want to get a head start on next year and start something in the fall. Again, check with your acupuncturist if you have one and get an energetic evaluation.
Okay, this will definitely help her, right?
I can't say definitely, but there's a good chance that it'll give her some sort
Really?
of, yeah.
Thank you very much, Paul. Have a pleasant evening.
Thank you.
Good night, sir. Go ahead, Kathy from New Britain. You're on.
Hi. Could you tell me if acupuncture could help PMS migraine headaches?
Yeah. Acupuncture is great on PMS. Just like the example that you saw on the at the beginning of the show where we did some ear points, that's just a basic stress treatment, and that's the beginning of treating PMS also. But there are different meridians that are blocked depending on what's going on with you, and there are so many variations that it would take a long time to talk about, but acupuncture does work with PMS.
It does. Okay, thank you very much.
You're welcome.
Thank you very much, caller. Have a pleasant evening. Go ahead, Lucinda from Hartford. You're on.
Yes, hi. I'd like to know, is that good for people that have trouble snoring at night?
Well, there are some points that are designated to stop snoring, but I've never tried them, so you never know.
Yeah, 'cause I have trouble at night. I snore a lot, and my family don't like it. I don't know how I stop it.
You got to roll over on your side, right?
Yeah.
Yeah.
Because I was thinking about getting it done because I have other problems I've been facing, and it confuses my mind. I get confused a lot and upset, and I was thinking maybe that would help.
Well, you know, you can always try it. The worst thing that's going to happen is you'll get a nice, relaxing treatment, and you'll feel good.
Does it hurt to get it done?
Hurt? No. No, it doesn't hurt.
Does it cost a lot of money to get it done?
Am I allowed to talk about money? There are a variety of prices. Prices vary all over. It can be anywhere from $40 or $50 to $130. So check around.
Yeah, because I'm on the state for the handicap.
Yeah.
I want to check with insurances, too, then,
Yeah.
or titles.
Yeah.
Thank you very much, Lucinda.
Okay, thank you. Have a good day.
You too. Have a
Bye-bye.
pleasant evening. Go ahead, Ann from Plainfield. You're on the line.
Hi, good afternoon. I'm calling about a traumatic brain injury victim. Could you tell me if acupuncture would inhibit or accelerate the healing of a brain injury?
My guess is that it would help open up the pathways, because I treat people that have memory impairments and also some closed head injuries. But what I also do is I tie on a little bit of biofeedback, and I get the sensory perceptions right up on my computer so that I can see the brain waves, and I work with that.
You do?
Yes, I do.
Okay, do you also connect nerve tissue? Do you work with the nerve tissue from the brain, like a spinal injury or a back injury?
I'm not a neurologist. What I basically do are the acupuncture points to open the meridians, but by connecting the sensors onto the head and the ears at different points, to be able to see an EEG on the computer and see the brain waves, we can at least balance what's going on.
Okay.
And it takes training. It takes training.
Does take, yes, EEGs are complicated. And being an RN, are you practiced in that? Or are you?
Well, this doesn't have to do with my RN stuff. It basically has to do with biofeedback training, and yes, I am.
Okay. Thank you very much.
Thank you very much, Ann. You have a pleasant evening. Bonnie, I can't thank you enough. I can't believe that time has gone by so quickly. You're going to have to come back again. We're going to have to talk about the regression aspects again, and maybe I'll let you do me right here on the air.
Oh, but
Bonnie,
we'll lose
thank
you.
Thank you very much for being my guest.
Thank you.
And when we return, I'll be taking your phone calls. And those of you who are already waiting on the lines, please be patient and stay with us. We'll be right back after this. Welcome back. Go ahead, caller from Norwich. You're on.
Yes, Pat. I'd like to know if I have an opportunity for promotion in my job. And the other question I have is...
okay, I'm sorry, caller. I'm going to have to interrupt and interject here for a minute. Very first impression that came to me when you asked me about position, I don't know why that I felt standstill. It's like maybe this promotion was due to you before, but there was an inability to give it to you simply because of situations. My mind said standstill, meaning unable. But I will tell you this, probably again before cold months, so any time between now and then, that promotion will come into play. So yes, to answer your question, but patience is the key here. Now go ahead with your second question.
And I also wanted to know if it'd be possible for me and my wife to buy a house within the next year.
I'm going to say yes, but I feel things are really to the wire for you, caller. Things have been to the wire for you for some time, but I'm also feeling that planning has been better, meaning like maybe for the last 3 to 5 months, you've really been planning for it, so monies are a little bit better. I won't say they're great, but they're better. So to answer your question, yes, again, patience, okay?
Okay, very good.
Okay.
Thank you.
You're very welcome. Go ahead, caller from Norwich, you're on.
Yes, hi, Pat.
Good evening.
I'm just wondering if you see any improvement in my health in the near future. And also if there would be...
Wait, let's do one question at a time because the energy starts going. So, and when you throw another question, then it's like interference, like watching one TV channel and then swinging the antenna around to another one. We get that little bit of interference. Let me answer the health question first. Immediately what came to my mind is there definitely is a need to stay under some sort of medical supervision. I don't mean it's life-threatening. That's not what came to me, but something that requires your stamina, something you need to stay attuned with and also need to be in control of. Your willpower, like this as far as nutrition goes, and that kind of gave me a little concern for you. Your health, I feel more like debilitating, more of feeling run down or tired, along with some other ailments in this area. Now, I don't know if it's allergy related. I'm not a doctor or diagnostician, but I can only go with the areas that come to my mind. But I think it's something you probably live with. And it's not, again, I didn't feel anything life-threatening. The second question you may now ask. Go ahead.
Okay. Career change in the near future or job change.
Okay. On hold. I think you've been wanting to do this, but it's like you're on hold. It's like you, maybe a little bit of fear, maybe a little bit of concern about making the change, but I believe it's going to come to having to make the change. So I'll answer yes to that as well, but later in the year. Any time between now and the latter part of this year.
Okay, great. Okay, thank you, Pat.
You're very welcome. Thank you.
Night.
Good night. Go ahead, caller from Rockville. You're on.
Good evening. I was calling. My brother is having some medical problems, and I just wondered if
it's something that could get serious, or it's just something that's going to pass?
Well, I'm concerned too. I'm not comfortable with what I felt about your brother taking charge of what's happening to his body. I believe there needs to be a better look from him, looking at what's going on with himself and saying, okay, I have to be in charge here. I have to make things better for my body. And that goes along with taking care of himself in as much as working out some, better nutrition, less stress. So that all has to go hand in hand. And I will tell you that if he doesn't take these measures, then I do feel that the situation can very well worsen. So please, if you have some influence, and he's not an easy person to talk to, and I know that too, but if you have some influence there, caller, you should encourage it for him.
Okay, thank you very much.
Thank you. Good night. You're very welcome. Go ahead, caller from Jewett City. You're on.
Yeah, hi, Pat. I'd like to know what you see in the very near future for me as far as job opportunities or career potentials.
Okay, is there any reason I sense that you do something now that you're in a hurry, that you work quickly, that your whole body has to move rather quickly at times, not on a continual basis, but at times, like you have to maybe gather work or get work out? I feel hurried, I feel rushed, and I wanted to know why I would perceive that.
Because I'm broke.
Are you trying to tell me you work more than one job?
No, I'm not working at all now.
At this point. Okay, what were you doing before you were out of work?
I've done a lot of different things.
What was the last position that would keep you so...
working at McDonald's.
Oh, okay then. So it was like waitress work and hurrying up to get the food out.
Right.
Okay. Well, then I'm going to have to say that's probably the type of work you're going to go back to, because I again feel hurried, getting things and rushing around. So I'll tell you, probably do the same kind of work. It may not be around the corner for you, unfortunately, but don't give up. That's the encouragement I want to give you.
Can I ask a second question?
Sure, go ahead.
What do you see in the relationship that I'm in now?
Ooh, I'm going to have to answer that honestly. That's why you called.
Right.
So the very first impression that came to me was a relationship where there might be two people occupying the same space. Communication, I don't feel is positive. I feel it's in spurts and some guesswork going on. And if my attitude about relationships is the person in your life should be your very best friend. And we treat very best friends how? We treat them with respect and consideration. We don't want to hurt them. So in this case, I think you ought to lay your cards on the table and say, look, where do we go from here? I think that's real important, caller. Okay?
Okay. Thanks, Pat.
You're very welcome. Thank you very much. And now we must take a word from our sponsors, and when I return, I will be answering your mail. Those of you who are waiting on the lines for me, please be patient. I will be with you soon. Remember, when writing to me at Insight, Post Office Box 425, Jewett City, Connecticut, 06351, you must include a self-addressed stamped envelope, a photograph, preferably a single-person picture, and up to 2 questions. If you are writing to request any information, such as brochures, calling cards, etc., from our guests, please mark the outside of your envelope that is addressed to Insight. Please put the date and topic of the show. All other mail is answered on Insight. I will respect any instructions that are stated in your letter as to how to disclose the information on the program, such as initials only, city only, etc. Now, don't touch that dial. Welcome back. Before I read my very first letter this evening, I hope you're watching Agnes R. from Holyoke, Mass. I received your lovely card, but you failed to include a photograph and you failed to include your address. So please resubmit to me. Now, the first letter I'm reading tonight comes to me from Amy M. from North Grosvenordale, Connecticut. You asked me, Amy, about health, and you also asked me about reincarnation. Amy, in looking at your photo, something in and around my stomach and my blood came to my mind. I'm not a doctor or diagnostician, but I do key into certain areas from the energy that is presented to me. I also felt in your case that nutrition is a must. Your emotional and your mental health also gave me a great deal of concern. I felt a lot of mood swings. It could even be perhaps PMS, and that could be why I focused on the blood. But it's something that I feel should be looked into for you. Reincarnation, I don't do only through hypnosis. I don't do it through looking at pictures and saying, okay, this is what you were in another life. But I do deal with it through hypnosis, or you may want to consult with Bonnie Carey. The next letter comes to me from Terry S. from North Grosvenordale, Connecticut as well. You asked me about relationship, and you asked me about more children. Terry, in looking at your photo, a smile crossed my lips, and also sadness touched my heart. You have so many ups and downs in your life, and basically a lot more downs than you've had ups. You need to get in touch with the real Terry. Really pull out the real Terry, not the Terry that you feel needs to be or to make a precedent in your life. You need to make yourself happy first, not other people around you. And I need to feel from you more motivation, for I felt you lacked some self-control to make these positive changes in your life. Unfortunately, I did not feel commitment as in marriage for you right away, but I do feel a relationship sometime in 1994. Exactly when on the time, it was not clear enough to me to relay to you. I did feel that 94 would be a much more satisfying and gratifying year for you than what you've been through, say, the last 3 or 4 years. More like becoming... 94 will not be truly satisfying or really gratifying, more like becoming somewhat dissatisfied and unfulfilling in spurts, but not as great as it has been. Unfortunately, I do not feel any more natural children in your life, I'm sorry to say. And thank you for your letter. The next letter comes to me from Ethel T. in Scotland, and my dearest Ethel, you asked me about a move and the right things, and your letter brought to me so much joy. I couldn't believe the age that you gave me in your letter. Your letter touched me deeply. The only wrong things that I felt about you or in your life is that you simply need to live in a quieter environment. I feel that all the moves that you've made are not, so to speak, wrong moves, but you need to be, at this age of your life, away from a lot of children and activities that aren't quieting for you. If you are going to choose an apartment in elderly housing, then I think I would feel a lot better for you, that it would be much more calmer of an area and much more quieter, but that's not the impression that came to me. I felt that you are a woman with a lot of inner strength and a lot of convictions, even at your wonderful age of 90. Be certain, I didn't feel real concerned about the move other than what I've just outlined to you. If it's going to be a move where there's not going to be quiet and calming for you, then please reconsider, because the move that came to me, I sensed a 2-story house, or 2-story meaning maybe 2 floors. I didn't feel you on the 2nd floor, but I did feel a family above you, and probably with noise. I would be much more comfortable if I knew you were going to move into elderly housing. God bless you, Ethel, and thank you for your wonderful letter. The next letter comes to me from M.B. in Norwich. You asked me about a move and a relationship. Dear M, in looking at your photo, I did not feel a move in the immediate future. And immediate to me is like within the next couple of months, or even within maybe the next 6 months. I did feel a family trip for you, or some sort of a trip, planning a trip, I felt, somewhere south, perhaps to investigate, if I may use such a term, for a prospective move down the road for you. Your personal life, love life that is, of course, has had many downs in the past 3 years, but I do sense some positive energy coming to you within 94, 95. So I think I'd stick around a while if I were you before I decided to make that move. God bless you, and good night. The 5th and final letter that I'm going to read to you this evening comes to me from Joan B. in East Hartford, Connecticut. You asked me about health for your daughter and distance from the husband, and you also asked me something about bad luck. Well, I use that term, but I use it only as an adage because I don't believe in bad luck or good luck. I believe that we have to take charge of our own life and making our luck positive. Let me put it to you that way. I felt a mixture of emotions in looking at your photo. I know that you said your family life was fine. However, that's not what I felt. I felt that communication with your husband is very strained. Feelings of uncertainty and doubt from you, but not being expressed to him. That's what I felt from you, but I don't think you're telling him that in more or less being totally upfront. The energy from your husband shows me a man who is a private man. He does not like to openly express things of a real private nature. And he holds those emotions near and dear. That private family matters are just simply that, private. There are things that are going on with him that are uncertain, and I don't think he's expressing them to you. There is some confusion going on, and I feel there is a definite need for an intermediary, a counselor, an analyst, a therapist, if you will. It is evident that he loves the children. I did feel that from looking at the photo, but it was also evident that there is an undercurrent between the two of you that certainly needs to be addressed, but with love, patience, and kindness, not with demands and not with a lot of insecurity. Good luck to you both, and God bless. Now, when we come back, I will be going straight to the line, so those of you who are waiting patiently for me, stay with me. Remember, the new toll-free number to call for everyone, in-state and out-of-state, is 1-800-300-TV26. I'll be right back after this. Welcome back. Go ahead, caller from Jewett City. You're on the line.
Hi, Pat.
Good evening.
Could you tell me, I haven't had very good luck with relationships lately, and I am a single mother.
Mm-hmm.
Could you tell me if there is someone in my future and more children?
Well, it saddens me to have to tell you that I don't feel it around the corner for you. I will answer yes to you, caller. However, there's something else I feel a need to tell you. There's been 3 relationships, 2 rather close, and one I felt a little more space. Now, it could be just totally the opposite, that there was one for more length of time and then 2 intermittently within a short period of time. And what concerns me is the type of individual that you're being drawn to. You're such a giving person, but you give 200% right away. It's like I almost sense in you a desperate want so bad to let someone know how much you want to fulfill somebody else's life, that the type of man that you're bringing in is almost like another child, someone that you have to take care of, that you give and give and give, and then when it's not being returned, there's this other side of you that makes you all the things that you don't like, things that make you upset and uncomfortable and crying and almost having to like plead for them to realize your needs. You don't have to do that, caller. There's so much love about you. There's such an energy about you that you're just very giving, and you need to get that kind of response back, not someone who's going to look at it and take it from you and not be considerate of it. I guess what I'm trying to tell you in a nutshell is you need a man in a man's body. You don't need a little boy that needs all the consideration and all the caring. I think you know what I'm telling you.
Yes, I do.
And so what I'd like to continue to tell you is for the next, within an 18-month, 2-year time frame, get back in touch with that wonderful person that's been underneath all of this emotional downs, because it's been going on in your life way too long. And once you do that, and once you realize that you're all right again, you're going to see your life is going to turn around. It may be in time coming for you, but you remember this. Latter part of 94 and 95, you're going to look back on these past terrible 4 or 5 years and you're going to say, thank God it's over and it's been a learning for me, but it won't happen to me anymore.
Thank you very much.
God bless you. Go ahead, caller from Ledyard.
Hi, yes, I'd like to ask if my husband and I are going to be able to get the house that we're trying to get. And also, I would like to know if I'm going to get my career back at some point.
Okay. Well, I think I pull those in together. Now, let me tell you why. I know that your career is kind of like on hold, but I'm not going to tell you that you're not going to hear from either the job that you've left, a job that you're familiar with, or a job that you've been estranged from, so to speak. And also, my mind says with a move, career together. So I'm going to have to say, like, within a month, maybe 6 weeks, 2 months at most of each other, they'll come together. And there's two houses. One shows me an access highway road, and I go on a hill or up a knoll.
Boy, are you right.
And there's, in this house that's on the knoll, the grounds are not finished, or they're in need of sprucing up, because I feel undone, unfinished. I like this one because I feel it's more removed, and God knows you need your space. You can work in a hectic environment. You don't mind that because you have the energy for it. But you need to be able to come home, kick your shoes off, shut the world out, and say, so, yes, and I'm very happy about it. It'll probably all come to pass for you before the end of the year.
Okay, thank you.
You're very welcome. Thank you.
Bye-bye.
Go ahead, caller from Taffel. You're on.
Hi, Pat. We were involved in an automobile accident. It's going to be 4 years now. And we don't seem to hear too much from the lawyers. Of course, it was out of state.
Yeah, okay. I think I knew that, caller. I probably wouldn't have said out of state per se. I just would have said distance, because that's exactly what came to me. And I'm going to tell you something else. If you're not aware of this, then you need to get in touch with the attorneys. I say in the plural, because I'm getting, for some reason, either a loss of information, information incomplete, something has been holding it all up due to paperwork. Are you aware of that already?
When I talked to the lawyer in Philadelphia, yes.
Okay.
You know.
Then you've got to get going on that and saying, okay, well, what are you doing? Did they recover this paperwork? Because without it, as it keeps dragging, unfortunately, I feel it becoming less and less in your favor. So I would get on the horn a little bit more often, and letters too. And when you write, I would encourage you to send everything return receipt requested.
Right.
Okay?
Okay. Thank you very much.
You're very welcome. Go ahead, caller from Old Saybrook. You're on.
Hi, Pat.
Good evening.
Hi. Do you see a man in my life in the future and possible marriage?
Aren't you basically asking me about someone that's already in your life? Somebody that's been on again, off again, Finnegan, if I may say, for the last few months?
No.
If that's true, what's going on since February, end of February or March?
Well, I just recently broke up with him.
Okay. Well, that's why I said in your life, out of your life, in your life. You may have broke up real recent, but it's not out of the picture yet, and that's why my mind said in your life, out of your life. So even though you may think you have the convictions that it's over, it's not over till it's over, and I'm still feeling a lot of loose ends. This will not be the man in your life for marriage, definitely not. This is not a nurturing relationship. It is not compatible. It is not complementary. A lot of almost like codependency, if I may use such a term. To answer your question, will there be marriage in your immediate future? I would have to say no. Do I feel middle of 94 making some change? Yes, I also feel with you some body change, physical. What exactly, I don't know. Maybe a new hairdo, maybe new self-image. But in that same time, it'll go hand in hand. Okay?
I have another question. So I'm
Go
going to
ahead.
be transferred out of my department to another department. Will I be happier?
Well, first of all, happiness has to start within. And you're going to have to look at these external situations, these negative external situations. You're going to have to start looking at them in a different light. You're going to have to go in with an attitude of, I can do the best that I can do, put my time in, and then go home. You don't do that. I feel like you go in, and you go in almost with a defense, an offensive attitude. That'll never work. I don't care what department you go to. You've got to look at others in their own way. And only then are you going to be able to seal yourself off, so to speak, and be okay. All right?
Okay, thank you.
You're very welcome. Thank you. Go ahead, caller from Basra. You're on.
Hi. Hi, Pat.
Good evening.
I was wondering, do you see a trip in the very near future for me?
Well, yes. I will answer that definitely affirmative. But a little confusing energies coming in here, like I feel like you've got the plans and yet you're like apprehensive. I don't know if you're apprehensive because you feel as though of funds or another individual, but it's almost like you've planned this before and it didn't come to pass.
Yeah.
Yeah, that's what I thought. So yes, and put the worries aside. You need to go. You need to get away. Even though your finances are tight, there's been a lot of, a lot of pressures about you. And, I mean, we all go through them, but yours even a little bit more so over the last few months. So go. Go and leave everything back here and have fun.
I also have another question. I have an older son who has a lot of health problems.
Okay.
And we've just gone through a lot of things about his feet.
Okay.
And I was wondering, do you see anything real close about his feet?
What about a procedure?
Surgery.
Yeah. I believe so. And I believe there'll probably be two.
Two?
Yeah. One, I felt corrective measures, and then a span of time probably for healing time and a wait-and-see kind of thing. But end analysis, I feel okay, because you're in the hands of specialists. You're in the hands of persons who deal with children and deal with these kinds of situations. So I'm going to be all right about that. Maybe that's why I felt all that added pressure for you. So you'll be all right.
Thanks a lot.
You're very welcome. Thank you. Now, stay with us, everyone. I'll be back in a moment, right after this. Thank you. Thank you for watching Insight. Join me again next Tuesday evening at 6 o'clock p.m. right here on TV 26.